Here, first question. Relaxation pressure is zero at which of the following lung volume? So here, question is zero. Relaxation pressure is zero. Answer is very simple. That is called functional residual capacity. Why? Suppose this is the lung, and in these two forces are working. One is outward force and one is inward force. So this outward force is actually chest wall. Chest wall is try to pull outward, and lung tendency is to collapse always. So these two forces are working opposite direction. Okay, and the balance at which uh, outward force and inward force is zero on neutral position, that is called functional residual capacity. That is called functional residual capacity at which the chest wall, which is trying to move outward, and lung, which is trying to collapse, so inward you can say. So both are balanced or neutral position, that is called functional residual capacity. So here this answer is very simple. So let's move to the second question. Here, arrange the following part of sarcomere, okay, from periphery to center. Okay, so I have already given one picture here. So let me draw one picture. So this is suppose one sarcomere, and obviously you know that this is the Z line. Z line. So Z line, and thin filament. So this is not suppose this is second sarcomere. So thin filament is here, thin and thin. So here also 1, 2, and 3. So that is called actin. So this actin, and in between actin, suppose this is actin. Here also this is actin. Okay. And it will, so this is the myosin. Okay, let me draw with some other color. So suppose this is myosin, this is myosin, this is myosin. Okay. So this is myosin, and here suppose that one is, it's called M line. So you can see here, this is the M line, and this is a Z line. This one is Z line. This is the Z line. So this one is Z line. This is M line. Okay. This one is myosin, and this one is actin. So here you can see this is actin. Okay, and this one is myosin actually. Okay, so this one is myosin here. This one is myosin. Okay, so here arrange the following part of sarcomere from periphery to center. Okay, so periphery, obviously this is a Z line, no confusion, and this part actually, this is the part is called I band. So from here to, not for here, for next cell also is this is called I band. I band. So this one, this is I band from here to here. This is thin filament. Actin thin filament is called I band, and you can see here from here to here. So both are there. So one is the myosin and one is actin. So actin and myosin both are here. So both are here. So that is called A band. So here you can see this is the actin and overlapping myosin. So this is called A band. A band. And only myosin is here. So this part only have myosin. This is only myosin. So that is called H band. And this is a M line in center, M line. So you can arrange like that. So first is Z line. So Z line. Then this is the I band. So I band. Then you can say, then after I we have A band. A band. And in center we have H also and M line also. So you can arrange like that. So Z line, then I band, this is the A band, then H is here, this is the H, and this is the M band. So if you get Z line first, then I band will come, then A will come, then H will come, and then M line will come. So like that you can arrange according to the option. So option was very so many options were there, so you can choose the option accordingly. Let's move to the next question. Hormone synthesized by a smooth endoplasmic reticulum. So I think all of you know the answer, so nothing to say. That is called a smooth endoplasmic reticulum. Answer is steroid hormone. Let's move to the next question. All vessels so Wien-Kessel effect except. So what is the Wien-Kessel effect? So elastic vessel, elastic tissue is more, that vessel will show Wien-Kessel effect. Here I have shown the picture. Heart pump blood. So this is the heart. Heart is pumping blood. So blood is pumped, pressure generated, and that will move. Elastic vessel will actually expand between the heart and aorta, left ventricle and aorta. Valve will close. So no, when heart will undergo or left ventricle will undergo isovolumetric relaxation or relaxation or diastole, in that case pressure will decrease in the ventricle and then blood will try to go backward. In that case, the elastic recoiling tendency of this great vessel or major vessels actually maintain the pressure. So that is called elastic arteries. So the arteries or major arteries who has more and more elastic tissue effect will give more and more Wien-Kessel effect. So the artery aorta is the major vessel, so obviously they will show the Wien-Kessel effect. So this is the except, we are looking for the except, the vessel which will not show the Wien-Kessel effect. So aorta will definitely show the Wien-Kessel effect because aorta is thick vessel and major vessel, and that have more elastic tissue. Renal artery is again is a direct branch of the aorta, abdominal aorta, so this will also show some the Wien-Kessel effect. Then radial artery actually branch periphery, so this elastic tissue is also there but less amount. Elastic tissue will be the less amount, so that will show less Wien-Kessel effect, or you can say this is, you can tick mark as an answer, because other is carotid artery. Carotid artery is also so Wien-Kessel effect because this is the genetic from the aorta. So this is the main arteries. So here answer will be radial artery. Radial artery will have less amount of elastic tissue, and because of that this will show less Wien-Kessel effect. So answer will be the radial artery. Okay, all except. So let's move to the next question. Which of the following hormone act via JAK-STAT pathway? So here you can say first option is aldosterone. Aldosterone is cytoplasmic, so this is not answer. Calcitonin and vasopressin will act through GPCR, G protein coupled receptor. So this will not your answer. So leptin, you can say leptin will be your answer. That is act via JAK-STAT pathway. Other hormone which act through JAK-STAT pathway is called growth hormone. You can say growth hormone, leptin, then prolactin and IGF-1. So leptin you can say here, prolactin, IGF-1. So these are act through JAK-STAT pathway, and leptin also there. Aldosterone, intracytoplasmic, and then calcitonin, vasopressin, G protein coupled receptor. Through G protein coupled receptor. So your answer will be JAK-STAT pathway is leptin. So B is answer. B, leptin will be your answer. So now next question, blood pressure change Here question is blood pressure change in radial artery were measured. So we are measuring blood pressure in radial artery. The initial rise of BP in Valsalva maneuver is because of. So in Valsalva maneuver is what? You will close the glottis, nose and glottis, and blow means pressure is increased where intrathoracic pressure will very high. So in that case, if you blow for some time and maintain, so that is the called straining. So initial here question is the initial rise of BP in Valsalva maneuver. So you can say blood pressure diagram is there. So this is the normal. When you start Valsalva maneuver, so pressure is increasing. So you can say the pressure increased and then again pressure decreases. So here question is that initial rise of pressure in Valsalva maneuver is because of what? So here understanding is that when you strain, in that case intrathoracic pressure will increase. So that will actually increase the return or blood to the left ventricle, and so left ventricle filling pressure will increase and systolic blood pressure will increase obviously. So but here let's see the answer. Decrease options. So first is decrease in left ventricular volume. So no, left ventricular volume will actually increase because you are increasing the intrathoracic pressure. So blood from the lungs will drain more and more to the left side of the heart. So left atrium, left ventricle, and pressure will increase. So this is not the answer. Decrease left ventricular pressure. No, pressure will also increase because that blood volume will increase. Compression of the aorta and pulmonary circulation. Yes, compression of aorta will be there because you are compressing. Pressure will increase. So that and pulmonary circulation. Obviously, this is going to be your answer. Compression of aorta because intrathoracic pressure is going to increase. Increase venous return. No, this is the decrease after some time. Venous return will decrease and that's why there decrease in the blood pressure. So this is the second part of phase if you continue straining. So in that case decrease venous return and then intrathoracic pressure will increase, and that because of that increase no decrease in venous return. So answer will be compression of aorta and pulmonary circulation. So now let's move to the next. Which of the following stimulate bitter taste receptor? Bitter taste receptor. So amino acid is actually sweet and umami. So this is sweet and umami taste you will get with the amino acid. Alkaloid. Alkaloid actually give you bitter taste. So answer will be alkaloid. Hydrogen ion is sour. Aldehyde is also sweet. So amino acid, sweet and umami. Alkaloid will give you bitter taste. So answer question is estimate bitter taste. So bitter, your answer will be alkaloid. Alkaloid will be your answer. Hydrogen ion will give sour type of stimulation. So let's move to the next question. Calculate the anion gap. Anion sodium is 145, potassium is 4, chloride is 80 millimole, bicarbonate is 30 millimole. So actually anion gap is calculated by sodium and you can add potassium also. So if option is there then you can add, and if not there then no need to add. Sodium plus potassium. So sodium is 145 plus 4 minus chloride and bicarbonate. Chloride plus bicarbonate. So chloride is 80 plus 30. So is equal to 149 minus 110. So is equal to 39. So here answer is option 78 no, 87 no, 35 is here answer, and 43. So 43 is not there. So I think potassium was not there. If potassium is there then you can show 39. If potassium is not there, potassium you can remove. Your answer will be 35 because so directly 145 minus 80 plus 30. So 145 minus 110, 35 will be your answer. Cystic fibrosis leads to defect in which channel? So answer is very simple, no chloride channel. So cystic fibrosis defect is because of chloride channel. So CFTR gene is there, so that defective gene, because of that this cystic fibrosis. Which of the following is a maximum thermogenic effect? Again, this is a very simple answer. 14 is the maximum thermogenic effect. 14 will be your answer. So maximum thermogenic effect, maximum is with the 14. So 14 will be your answer. Here question is true statement regarding skeletal muscle contraction. So here intracellular calcium is important for contraction. Intracellular. So calcium is important for contraction. Say yes, intracellular um, calcium is very important for contraction, because this intracellular calcium will release, and that will actually help in the contraction. So that is right, is it true? So true statement we are looking for, so that is the true statement. So let's say see the other options. So calcium released from sarcoplasmic reticulum, yes, is not important. So not is not so important. Actually calcium is released from sarcoplasmic reticulum is important, so this is not going to be answer because this is not important written here. Then calcium released from mitochondria, obviously this is not going to be answered. Calcium released from the cytoplasmic reticulum or intracellular calcium is important for contraction. Voltage gated calcium channel is opening is needed, so no, voltage gated calcium channel is not needed here. Is needed in the cardiac muscle, or you can say smooth muscle. So this is not going to be answered. So answer will be intracellular calcium is important for contraction. If it is written here calcium released from sarcoplasmic reticulum is important, then it right choice, but here it's not written here. So this is not a true statement, this is the false statement. So this is the true and this is a false statement. Okay, and these two are also false. Here the question is, in the given curve indicate which of the following. So this is the curve, and option is A hypoxic hypoxia, B histotoxics, then anemic hypoxia, then stagnant hypoxia. So let's discuss first this graph and then we'll go to the options. So here we can see partial pressure of oxygen. So this 0, 20, 40, 60, 80 and 100. So partial pressure of oxygen is 100, up to 100 level. And here oxygen ml per deciliter. So here oxygen, content of oxygen per deciliter. So here is 0, here is 5, 10, 15 and 20. 20 is the maximum, around 20, 21 is maximum oxygen carrying capacity of blood. If hemoglobin is 15 gram per deciliter, so 1.34 ml per gram of hemoglobin can carry 1.34 ml. Around if 15 gram of hemoglobin is there, then it will be around 20 ml per deciliter. So here is the 20, this is maximum. And two graph is showing, one is this dotted line is showing saturation is around 100 and oxygen content is also around just around 90 here in the first graph. And here we can say oxygen saturation is, partial pressure of oxygen is okay, it's around 95 or 100. At the same level oxygen, total oxygen is around 9 or 10 ml, less than 10. It means this clearly indicating that this is the anemic type of hypoxia. So answer will be anemic hypoxia. Why? Because this normal graph oxygen is 15 gram per deciliter, around 15. At 15 gram hemoglobin carry around 19 or 20 ml oxygen. At the same time here hemoglobin is 7.5, so hemoglobin is less, and 1 gram of hemoglobin can carry 1.34, so 7 or 8, its total oxygen carrying capacity is reduced, less than 10. But same time partial pressure of oxygen is normal without any change in the partial pressure of oxygen. So because of that this hypoxia will be anemic hypoxia. Where one more thing you can see here, this graph is shifted towards the right. This is not left. If graph is shifted towards left, that like this, in that case you can say this is carbon monoxide poisoning. In that condition, graph will shift left. And in oxygen, in the anemic type of hypoxia, graph is usually shift to right because of increased production of 2,3-DPG and other factors which actually help to release oxygen more to the tissue level. So here oxygen release will be more, and carbon monoxide poisoning, oxygen release will also reduce. So that's curve or graph is shift to left. So this is not option here. Carbon monoxide poisoning is not option here. Clear cut answer is anemic hypoxia because graph is already shifted towards the right. So this is anemic hypoxia and oxygen carrying capacity is already less. Let's talk about other hypoxia. So because hypoxic hypoxia, this partial pressure of oxygen will reduce. So partial pressure of oxygen here is showing around 100 or 95. So this is not the answer. Then histotoxic hypoxia. Histotoxic hypoxia, if you want to check, then arteriovenous difference of oxygen you have to check. And in the same case, stagnant hypoxia, you have to check arteriovenous difference. Suppose in histotoxic hypoxia, oxygen content in arteries and veins will be difference will be very less because oxygen utilization is reduced. Tissue cannot utilize oxygen. Oxygen is available, but tissue cannot utilize oxygen. So in that condition, oxygen remain in the blood. So oxygen venous and arterial oxygen difference will be less. And stagnant hypoxia, what happens? Opposite to that. Blood will remain more and more time to the tissue space, and that's why more and more oxygen will be extracted from the blood, and oxygen from arterial and venous oxygen difference will be more. For that, we need arteriovenous oxygen difference for histotoxic and stagnant hypoxia to know, to check whether this hypoxia is a stagnant type of hypoxia or histotoxic hypoxia. So in that case, we have to check arterial and venous oxygen difference. So answer here will be the anemic hypoxia, clear cut answer. So let's move towards the next question. Correct order of auscultation on left side of chest from superior to inferior. So we are talking about the left side of the chest. This side is the left side and this is the right side. So here question is correct of order of auscultation on left side of the chest from superior to inferior. Means superior to inferior, you have to go from this direction to this direction. So first, here is the right side. We have right second intercostal space is aortic area, and the same left second intercostal space we have pulmonary or pulmonary area. Then in fourth intercostal space we have tricuspid area, and in fifth is mitral. So auscultation will go like this. So auscultation will go like this. First is pulmonic area, second, okay, then tricuspid, this one. So first is pulmonic, second one this one, tricuspid, and third one is mitral. So it will go like this. So pulmonic, tricuspid, and mitral. So this is going to be your answer. So answer is here. So here Babinski sign. This picture is showing. So what is Babinski sign? We strike with the blunt object like keys to the lateral surface or plantar surface of the foot, lateral side, from lateral to the medial up to this level. And response, normally two type of response you will get. One is Babinski positive and one is negative. In negative there is a pentaflexion. So this is the negative Babinski sign. Babinski sign is negative, and in that case Babinski sign is positive. There is a dorsiflexion and fanning of the toes. So toe will be like this, fanning and dorsiflexion. So here this dorsiflexion and this is the fanning of the toes. So this is the Babinski sign positive. So and Babinski side positive in upper motor neuron lesion in the pathological condition, and physiological condition in the sleep you may get in the sleep and children less than 2 years, because myelination is not completed at that point of time. So in that case you may get Babinski sign positive. So positive sign you may get normally also in case of sleep, deep sleep, and in case of children below 2 years of age, and in the pathological condition upper motor neuron lesion. And let's discuss about the equilibrium potential, which is actually calculated. How will you calculate equilibrium potential? With which equation? Nernst equation. So this is the formula. With this you can calculate the equilibrium potential, and this is calculated for freely diffusible ion which is freely diffusible, means can go in and out freely. So that ions can only considered in the equilibrium potential. And this is the normal equilibrium potential of sodium is plus 61 millivolt, potassium minus 90 millivolt, chloride is minus 70 millivolt, and calcium is plus 125 millivolt. So these are the equilibrium potential of different ions, which is freely diffusible. Which amino acid is not used for synthesis of hormone? So here simple answer is the glycine. Glycine is not used for the. So tyrosine is used, phenylalanine is used, tryptophan is used. So these are the use, and what is not used? The glycine. So glycine will be answer not used. So glycine. And thank you.